For today's face-off, and President Obama's claim that reforming health care is, quote, a moral obligation.
Monica, the president held a conference call with religious leaders this week to plead with them to use their influence to help sell his plan for reform.
I know there's been a lot of misinformation in this debate, and there are some folks out there who are, frankly, bearing false witness. These are all fabrications that have been put out there in order to discourage people from meeting what I consider to be a core ethical and moral obligation, and that is that we look out for one another, that I am my brother's keeper and my sister's keeper. And in the wealthiest nation on earth right now, we are neglecting to live up to that call.
Are congressmen and voters likely to take their moral marching orders from the White House? Is the president hoping to tap into what Richard Nixon once coined the silent majority, or is he hoping to reach the late Jerry Falwell's moral majority? Here to face off are Democratic strategist Chris Kofinis and Republican strategist and MSNBC political analyst Joe Watkins. Joe, I want to start with you in two very simple yes or no questions. Do you believe that, yes or no, there is a moral obligation to give people who don't have health insurance of some kind? And secondly, do you believe there's a moral obligation to talk about health care issues honestly?
Yes, I think there's a moral obligation. It'd be great to give everybody health insurance. Every American ought to have it, but not this plan. This plan is not. This plan is a government-run plan, and the moral thing is to let people know that it's too much, too fast, too soon, that it won't work.
How is it a government-run plan? Because I thought you just said it was important to be honest about these issues.
It is.
How is it government-run?
Well, it's government-run when the government is competing against private industry, which can't compete with government, which doesn't need to make a profit. It's government-run when the government makes choices for you, and you don't have the opportunity to make choices yourself. Anytime the government is telling doctors what they have to do, is telling the insurance, is competing with the insurance companies, is likewise telling people,
except in the time of Medicare or Social Security or Veterans Affairs, where that's government
under this new plan, this socialized medicine plan, what ends up happening is you have comparative evaluation research, which means that some people may be told that they're denied treatment because it's not cost effective, not fair.
That's just not true, Joe.
Well, there is comparative. $1.1 billion has already been set aside for cost of.
Let him talk.
Here's the part that I find funny about this whole argument. Republicans who like to talk about family values, they like to talk about values, but here is a true moral imperative. There are tens of millions of Americans in this country today that are waking up wondering that if they get hit by a car, how are they going to pay for the bills, let alone how are they going to keep going on. We have 1.5 million people who lose their homes because of medical costs. We have tens of thousands of workers who are let go because of the rising cost of medical health care. This is a great moral imperative.
Chris,
and to hear
what
Republicans,
about the business people who are going to be forced to lay off folks because they can't pay the 8% raise in taxes, payroll taxes?
To hear Republicans talk about health care after they were in power for 8 years and did nothing, and bring up these arguments about we should use tax cuts or we should use health care savings accounts, none of that will get to the core problem, which is exploding health care costs, which are going to double, let me make it very clear, double over the next 10 years. And that is both an enormous problem, not only for individuals, but for corporations and the businesses that you talk about.
I want to give you an opportunity to respond, Joe, but first I want to read you what Joe Klein wrote today, and we're talking about government takeover. He says the same people who rail against a government takeover of health care tried to enforce a government takeover of Terry Schiavo's end-of-life decisions. And when Palin floated the death panel canard, the number of prominent Republicans who rose up to call her out could be counted on one hand. It's hypocrisy, isn't it, Joe?
Well, all I know is that we have to look forward. We can't look back. I don't want to talk about what happened several years ago. What I'd like to talk about is the number of people that are going to be put out of work by an 8% raise in payroll taxes for small businesses under this bill. Why rush this bill through? If you want to help people, tell them the truth. Let the folks know. Let me finish. Let's tell the folks who are going to be hurt that they're going to be hurt. The president said it on Saturday. He was honest. He said, some folks are going to be hurt by this legislation. They ought to know who they are, and they ought to know how they're going to be hurt.
It's very clear what the Republican strategy here, which is to slow boat this thing to death. Well, at the end of the day,
how many Democrats have read the bill?
If you, for example, Republicans oppose the public option, I've said this before and I will say it again, then be true to your convictions. Come out before the American people say we will not vote for any more funding for Medicare, for Medicaid, for veterans health care, because that is public health care. So personally, I'm sick and tired of the hypocrisy on this issue.
People. Chris, let's help the American people. Let's tell them the truth. Let's not rush through a bill bill that's fraught with all kinds of problems. It's going to make health care more challenging for everybody.
Words of wisdom from Joe Watkins. If only members of his party would be listening. Joe Watkins, we appreciate it. Chris Kofinis, the Democrats also sometimes have problems with the truth, but right now it's the GOP problem. We appreciate it.